You might have some that has blood pressure problems, maybe anemic, maybe, you know, all these different things. But you all will target what they're really needing.
Yeah, we do specialty. Our doctors that come to our clinics are more specialists.
Right.
And focus on, like I said, specific concerns like heart problems or seizures, the neurologist, those kind of things.
And they can determine whether it's, you know, a real issue or maybe just nerve troubles.
Absolutely. The doctors, the cardiologists that actually come are from the University of Kentucky also. Dr. Noonan is a world-renowned cardiologist, and they usually bring equipment where they can do the echocardiograms right there in our office, so they can evaluate and see if your child's been told, like if you've been told your child has a heart murmur, you can come have that evaluated to make sure that it's might be an innocent murmur, or it might be something to be concerned about.
What about breathing troubles like asthma, like children with asthma?
Yeah, we in Barberville do not have an asthma clinic.
Okay.
But we, I think the Lexington office has an asthma clinic where they work more with kids. But there are other options. The ear, nose, and throat doctor can sometimes, you know, the asthma kind of goes along with allergies like we were talking about earlier. So we can, at the very least, help find somebody to help your child.
It's so phenomenal. They're reaching out. Once again, we want to give these numbers out to you again and their hours of operation. Right down in Barberville, Kentucky, the Commission for Children with Special Needs, they're open from 8 a.m. to 4:30 p.m. Monday through Friday. The 1-800 number is 1-800-348-4279, and anybody under the sound of her in the listening area right here can call.
Absolutely.
So do they have to schedule an appointment, or can they walk in, or what?
They can walk in. We have somebody there. We can answer questions if they want to walk in, and we can give them an application right there in the office. If they may have trouble, they think, with applications, we can help them fill it out. And because it is a kind of an intimidating application packet, because we ask for, of course, financial information and different health history and things. So we can help with filling out those applications.
And plus, you've got these pamphlets here to give them more info and stuff.
Absolutely.
You know, what is this one here?
I brought another pamphlet.
Yeah.
Our office is working under a grant with something called Family to Family.
Family to Family.
And they're health information centers. And what they are staffed, so to speak, by a parent that has a child with special needs. So it's someone that's been through somebody else, so they can help another parent. Maybe your child was just diagnosed with seizures or just diagnosed with cerebral palsy. There's somebody there that's been through it, and they can help answer questions. Sometimes, you know, a healthcare professional, as myself, a nurse, we can tell people, but people may not think I can relate, and maybe I can't relate because I don't have a child with special needs.
Experience.
But another parent that has special needs can really help. We don't currently have a parent consultant in our office.
Exactly.
If someone out there is interested, if you have a child with special needs or have had a child with special needs, and if you're interested in being a parent consultant or somebody that could help other families, you can call our office and we can give you more information about that.
That is so phenomenal. What about, you know, children that are scary and maybe have panic attacks, maybe even during the treatment? How do you deal with that?
Yeah, that's sometimes our doctors are all used to working with kids.
Right.
And know how kids, because kids a lot of times are afraid of doctors.
Oh,
and,
yeah.
a lot of times you just have to take your time. And the neurologists, I know specifically, oftentimes will do an examination when the kids don't even really know they're doing an exam. They're watching them, how they interact, how they walk, the things that they're doing. And that's all part of doing a neurological exam. So they might do an exam on the child without necessarily part of the exam. They have to eventually touch them, but they can get a lot of their exam by not even touching the child, and the child may not even know. Now,
how do you all handle this? Well, like if the child needs an MRI or x-rays or things of that nature?
Yeah, we can make arrangements and help them. A lot of children that have seizures, for example, that need a test called an EEG. It's
EEG.
An electroencephalogram that kind of measures the brain waves. and we will help make arrangements for them to get those tests done. We don't do those things. MRIs, a lot of times, kids with seizures get MRIs of the brain, and we will help make arrangements to get those done.
Oh, that's phenomenal. You all are helping so many children in this area, and you're doing such a phenomenal work. And having all these doctors coming in, specialists. And that's all. How long have you been in the nursing field?
I've been a nurse for 17 years.
17 years.
I've worked for the Commission for Children for 4.5 years.
4.5. So all your people down there are set and ready and prepared.
Sure.
For anything that may come through the door.
Absolutely.
Oh, that is so phenomenal. I'm not for sure how long we've got left in this interview, but I am so thankful for what you're doing with these kids. Maybe talk about some more experiences. How many, just on average, do you deal with in a week?
Though that varies a lot because we have clinics maybe once or twice a week.
Right.
Or